Are you aware of the dangers and risks associated with oral sex? Many people are unaware, or even believe oral sex isn't a sexually transmitted infection risk. Oral sex, however, can transmit several STIs. The mouth and oropharynx contain a polymicrobial flora. Bacteria naturally colonize this area, playing a role in digestion. Under normal conditions, these bacteria maintain a balanced population. However, disease can cause bacterial overgrowth or introduce new pathogens, such as herpes simplex virus or human papillomavirus. Furthermore, the urethra, the sterile tube carrying urine from the bladder, is susceptible to contamination during oral sex. Let's identify 5 common STIs transmitted through oral sex. 1. HPV. Over 200 HPV subtypes exist, some linked to oropharyngeal, penile, and cervical cancers. HPV can also cause benign genital warts. Oral HPV lesions may go unnoticed, increasing the risk of ulcers or malignancies for individuals engaging in unprotected oral sex. In Brazil, the incidence of HPV-related cancers is a significant public health concern, with programs like the National Vaccination Campaign working to mitigate this risk. 2. Oral candidiasis. This fungal infection, often transmitted through oral contact, can infect the glands penis, prepuce, and urethra, causing balanitis or balanoposthitis. Symptoms include local discomfort, redness, scaling, and burning in the penile area. Treatment typically involves antifungal, corticosteroid, or antibiotic medications. The prevalence of oral candidiasis is influenced by factors like antibiotic use and immune status, both of which are important to consider in risk assessment. 3. Herpes. Herpes simplex virus type 1 typically affects the mouth, while HSV-2 is associated with genital herpes. While usually localized, someone with a labial HSV-1 lesion can transmit the virus to the genital area through oral sex. The availability of antiviral medications in Brazil has significantly improved management of this condition. 4. Syphilis. Though less common, syphilis, a bacterial infection, can be transmitted orally. A characteristic painless chancre appears on the glans or prepuce, with raised edges and a firm base. Early diagnosis and treatment with penicillin are crucial due to the highly contagious nature of syphilis and its potential for severe long-term consequences. Brazil has ongoing public health initiatives focused on syphilis prevention and treatment. 5. Urethritis. This inflammation of the urethra, normally sterile, presents with redness, discomfort, and urethral discharge. Chlamydia and gonorrhea are primary culprits. Oral sex can serve as a transmission vector. Prompt diagnosis and treatment of urethritis are essential to prevent complications and further transmission. Access to STI testing and treatment is a crucial aspect of public health strategies in Brazil. Reducing oral sex risks involves reducing the number of sexual partners, practicing safer sex, and knowing your partner's sexual history. Using condoms during oral sex is highly recommended, much like one wouldn't share a toothbrush with a stranger. Responsible sexual practices are key to minimizing STI transmission.